I know we're all tired and we know only too well the long list of good habits that can help keep us and others healthier. So let's focus in on the top 3 recommendations. First, boost your immunity. If it has been 6 months since your last COVID-19 vaccine dose or booster, get vaccinated with a bivalent Omicron targeting booster. It is also a good time to get your flu shot. Secondly, protect your respiratory tract from invading viruses. Keep up with the hand washing, wearing good quality, well-fitted face masks when indoors, especially if you can't avoid being in crowded or poorly ventilated spaces. And lastly, reduce spread to others. If you have symptoms, please stay at home. This helps protect us all, including those at high risk of severe respiratory illness, such as those who are immunocompromised, as well as young infants, young children, pregnant people, and older adults. Protecting those who are at highest risk and can't be vaccinated or don't mount a strong protection is also key to protecting health system capacity for us all. To meet the challenges of this fall and winter, let's recommit to not lose the gains we've made as we resume in-person activities. Although no individual layer of protection is perfect, when used consistently and together, vaccine plus layers can provide excellent protection against COVID-19, as well as other infectious diseases we may encounter. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. Il y a actuellement des différences d'une région à l'autre en ce qui concerne les indicateurs relatifs à la COVID-19, notamment le nombre hebdomadaire de cas et le pourcentage de positivité au test laboratoire.
Nevertheless, SARS-CoV-2 virus transmission continues across the country, including with increased growth of emerging Omicron variants BQ.1.1 and BF.7. At the same time, other respiratory viruses, including respiratory syncytial virus, or RSV, and influenza, have increased to above seasonal levels as respiratory virus season gets underway early in Canada. At the national level, RSV activity began to increase several weeks ago, with lab positivity above expected levels for this time of year. More recently, influenza activity increased steeply and has already crossed the seasonal threshold of 5% lab test positivity. These surveillance indicators point to the need for stepped-up precautions as SARS-CoV-2, influenza, and other seasonal respiratory viruses could continue to co-circulate in the weeks ahead. We are likely all aware there are reports of heavy strain on emergency departments in many parts of the country. This includes children's hospitals, where RSV-related admissions have been very high. In addition, over half of recent influenza detections have been in children and teenagers. Although public health measures, including our individual prevention practices, kept COVID-19 and seasonal respiratory viruses at bay over the past 2+ years, this third winter of COVID-19 comes with some cautions. Firstly, with the relaxing of population public health measures and a return to in-person learning, work, and social activities, our contact rates have increased. This means more opportunities for exposure to COVID-19 as well as other seasonal respiratory viruses. In addition, although Canadians achieved among the world's highest coverage for a primary series of COVID-19 vaccines, many are beyond a 6-month time lapse since the last COVID-19 vaccine or Omicron infection. So immunity is falling, leaving us all less protected against severe disease. Last but not least, immunity to other respiratory viruses is lower, given less circulation of these viruses over the past 2 winters, as well as the need to update influenza vaccine protection. So, what do we need to do about these concerns? I know we are all tired, and we know only too well the long list of good habits that can help keep us and others healthier. So let's focus on the top 3 recommendations. First of all, boost your immunity. If it has been 6 months since your last COVID vaccine dose or booster, get vaccinated with a bivalent Omicron targeting booster. It is also a good time to get your flu shot. Secondly, protect your respiratory tract from invading viruses. Keep up with hand washing and wear a good quality, well-fitting face mask when indoors, especially if you can't avoid being in crowded or poorly ventilated spaces. Thirdly, reduce spread to others. If you have symptoms, please stay home. This helps protect us all, including those at high risk of severe respiratory illness, such as those who are immunocompromised, as well as infants, young children, pregnant people, and older adults. Protecting those who are at highest risk and can't be vaccinated or don't mount strong protection is also key to protecting health system capacity for us all. To meet the challenges of this fall and winter, let's recommit to not lose the gains we've made as we resume in-person activities. Although no individual layer of protection is perfect, when used consistently and together, vaccines plus layers can provide excellent protection against COVID-19, as well as many other infectious diseases we may encounter. Thank you.
Thank you, Miigwech.
Okay, we'll now move to questions. We have till about 10:45-ish. We will start with Cassandra Sklarski from the Canadian Press. If anyone else needs to ask or wants to ask a question, please raise your hand. I don't see any other hands raised at the moment. Go ahead, Cassandra.
Hello, good morning. Can you hear me?
Good morning. Yes, we can. Go ahead, Cassandra.
Great. Well, we're seeing pediatric centers, doctors saying that they're overwhelmed by very young, ill patients. And it seems to have only been made worse by parents who can't find pain and fever relief on store shelves. So I understand that hospitals will see more supply soon, but when will Canadians have access to more products?
Thank you for that question. Of course, from the Public Health Agency, we're not directly involved in the supply front, but I do know that our Health Canada colleagues are working extremely hard with different partners, including manufacturers, and that they've also enabled the importation of supplies such as ibuprofen from the United States and acetaminophen from Australia. So I think they're working as hard as they can to, with the understanding that, of course, parents and kids need these medications. But we are happy to have you follow up with our Health Canada colleagues.
All right. Can I have a follow-up to that question?
Yeah, go ahead.
Okay, because I'm wondering to what degree, like we're obviously seeing, this crisis in healthcare, and then the COVID vaccine uptake as well, with children under 5 remaining quite low. With all of these things together, like to what degree is this all contributing to the crisis in the healthcare system? But I'm also trying to parse out, I guess, the very low vaccine uptake with the under 5s, with the 3 viruses that you mentioned that are circulating much higher now than we've seen otherwise.
Yes, so the vaccine uptake for the youngest children has remained relatively low. I think is at about 6.5%. And so that can certainly be improved, and that we need to provide parents and certainly healthcare providers that they engage with the necessary information so that they can make that choice to get children vaccinated, but most importantly for kids with underlying medical conditions as well. But what we're seeing, I think, at the moment is a confluence of different viruses that are circulating at the same time. And that is what's impacting pediatric hospitals. So I think Canadians are just learning about a virus that we've known for a very long time that affects children every year, the RSV virus. So that's been the virus that's taking a big hit in terms of pressures on the hospital system. So, and there are other viruses, of course. Influenza is really just beginning to make a steep increase. So while it may not have been the predominant virus that's impacting children, we're definitely seeing that happening right now. So getting influenza vaccine is something else that parents and indeed anyone over the age of 6 months can do. And you can actually, for anyone over the age of 5, can get a simultaneous co-administration of influenza and the COVID shot. So all of these layers, and including all the ones that we keep repeating about, can help maybe dampen the surge to those hospital systems. And I think that's what public health can do to help, and everybody can play the role. And so at the same time, of course, we recognize that our hospitals are working really, really hard. And many people are working hard to try and make sure supplies and other important priorities are being addressed.
Thank you, Dr. Tam. I will move to Michelle Saba, La Presse Canadienne. Go ahead, Michelle.
Oui, bonjour à vous deux. D'abord, assisterons-nous à un retour en
Are we going to see a return in force of COVID-19 in the coming months? What can we expect in terms of transmission of the virus in the coming months? Yes, thank you for the question. This is Dr. Njoo. We don't have a crystal ball, but given what we've seen right now, the situation is more stable, but it's dynamic as well. We may be seeing an increase in COVID-19 cases, but as we said as well in our opening remarks, the respiratory infection season is starting. So it's not just a question of COVID-19. There's influenza for children, there's the RSV. So it's really an issue for us. How can we maintain the capacity of our healthcare system? Because it won't be just COVID cases, but other respiratory infections as well. So I think it's very important to underscore that everyone should keep their vaccines up to date, constantly use all the other layers of protection, masks that is well fitted in indoor spaces that are crowded, where there's a lot of other people close together, there's ventilation. These are the messages we've given many times, but I think it's important because what we're seeing with the viruses, it's the season, it's active. We saw the start of it already, so of course we could have a very difficult winter for all kinds of respiratory infections. All right, thank you. My second question, this is a 2-for-1. I'd like to know what proportion of the population is adequately vaccinated right now, and moreover, there are many people who seem to have gone beyond COVID-19 now. Do you think that pandemic fatigue is at play here, especially since immunity seems to be going down? Well, those are good questions. Thank you. The vaccine coverage
C'est toujours une question de regarder peut-être d'une semaine à l'autre.
Is something we have to watch week to week. We're talking about the primary series, the 2 initial doses. That's pretty good. The Canadian population is vaccinated of those 2 up to 90%, over 80% for sure. So if we look at age groups, older people are very good for getting their initial vaccines. If you're looking about the 3rd and 4th boosters, the situation may not be as rosy. Maybe 60% in general. It's difficult to say because that depends on age groups as well. But I think generally all Canadians have some work to do. We have to think about this. We're underscoring the message. Has it been at least 6 months since your last dose? Any dose? Maybe 6 months after you've been infected? If it's already been 6 months, time is now to get your booster shot. It's really the bivalent booster you need. That's the vaccine that has the original strain and the Omicron strain. So for winter, that's good protection. And at the same time, it's very important to get the flu shot. And for your second question, as far as pandemic fatigue, yes, indeed. I think that's normal. Everyone's fed up. It's been 2.5 years. Everybody wants to resume social activities, of travel, take vacations, go back to work in person and school. It's important for our society, but I think we have to strike a balance here. We know what the good habits are. Perhaps we could all continue to have social activities, but it's also very important for everyone to be cautious. If we want to join with others to do things, if there are people who are immunocompromised or otherwise at risk, it's very important. It's not just a matter of protecting oneself. You have to think of protecting others too. That's why we underline that. There may not be a requirement, but wearing a well-fitting mask is very important if we're indoors with other people in the winter, and keep your vaccines up to date.
Merci.
Thank you.
Okay, our next question will go to Zhaoli Li. If you can state your media outlet before you ask your question, please.
Hi, yes, can you hear me all right?
Yes.
This is Zhaoli Li from City News in Ottawa. I just wanted to ask, how is this season going to compare to earlier COVID winters? We saw a decline in seasonal flu and cold during earlier waves, if I recall, I imagine due to things like masking and social distancing. So with everyone taking that less seriously this season and this concurrent increase in flu, RSV, and COVID, how will this winter compare?
Yes, this is Theresa Tam. I'll answer that question. So we are already seeing the difference with this fall and winter season compared to the last 2 years. Of course, pre-pandemic, respiratory viruses do come around every year, including influenza and RSV. The pressure on the health system right now is because these viruses may be synchronized in terms of the timing, and that's what's pushing the pressure on the health system as well. So not only has the COVID-19 not done with us, even though we're fatigued, we're seeing the influenza really rising quite steeply right now. It's going to be different in different parts of the country, but in general, that's just beginning to climb. And then RSV that began a little while ago is still at a very high level. So that's quite different from the last couple of winters. And that's what's putting the pressure on some of the pediatric hospitals. As to how the rest of the winter will unfold, we're just going to have to watch it really carefully. And of course, we will provide updates as needed to people, and certainly at the local level. I know medical officers of health are trying to keep the population appraised of these activities, but we do know that during a winter period, we are going to get respiratory virus circulation, and that's why we're advocating for people to make sure they enhance those good personal habits.
It's Dr. Njoo. Maybe I just underline an additional point to what Dr. Tam has said, and that's the fact that the future is not predetermined. In many ways, we're in control of our own destiny. So, how sort of serious the upcoming, or sort of already starting at the beginning of the respiratory virus season. If people keep up to date with the COVID-19 vaccination, get their flu shot, and use in a consistent manner all of the good sort of personal protective measures, not just for themselves but to protect others. The consistent use of masks, especially in indoor spaces, are not well ventilated. Be thoughtful about who they interact with and so on. Then I think we might have a less serious season than maybe if people really, as they say, let go and don't sort of take it seriously and don't get their vaccination up to date and so on and so forth. So I think, it's not that it's going to necessarily be as bad just because we're going to say, well, that's the way it is. I think we can control that. So I think it's up to everyone to, as they say, do their part. Thank you.
And as a follow-up, Dr. Tam, during your prepared remarks, you mentioned that influenza and RSV lab test positivity levels were beyond what's expected seasonally. Do you have any additional detail, context, or specific numbers on how much beyond seasonal levels those numbers are?
Mm-hmm. Well, I think one is the timing. So it's a relatively early acceleration compared to previous years, certainly for RSV. So the timing is earlier, and it's within some of the usual. For influenza, we're just beginning, as I said, to see that steep increase. So it's just passing what we call the seasonal threshold for, beginning to be quite certain that the influenza epidemic is underway. So we're just at the beginning of that. There are some information on our website as well. There's Flu Watch, which it's easier if you see that curve going up. It's quite steep, but it's just at the beginning. So it's not that high, but it's accelerating. For RSV, it is above seasonal levels. And we had the indicators to mainly from a laboratory detection perspective. And so I think depending on what happens next, those could be very sharp peaks that go up and come down, or they could be less sharp but more prolonged. We don't know that yet. So you can. There's a number of different indicators that you will be able to see on our website.